Before I go over the objectives, what I would like to state clearly, I am a certified TF-CBT trauma therapist. However, I am not a certified TF-CBT trainer. If y'all know the difference, of course. So what I am sharing with you is how I use the TF-CBT model in my practice and how you can also use it in your practice. Okay, so our objectives, we're going to go over what is natural grief and then what is childhood traumatic grief. You'll hear me say CTG, that's what I'm referring to. 23 years in the military community, I love acronyms, so if I will try and yield back and explain the acronym, okay? And then going over some of the practice model components of TF-CBT and how I utilize those into my practice and treatment. Of course, treatment implementation of the CGT, using those components of TF-CBT in a treatment plan. So grief. One of the things that we do at the bereavement center is we have an intake process. The first thing that I do in the living room is go up to the children and say, do you know why you're here? Or what is your understanding of what we do here? The reason I do that is because I want to be on the same level as those children. I need to be on the same page from the beginning. Then we take a tour of the facility, and then we sit down. And that's when I ask them, what is your definition of grief? So I'll ask you all, what is your definition of grief? Sorrow that follows a loss. Anyone else? What do you think children tell me? Sadness? That's what they always say. Or they say, I don't know. Just like in the first meeting, I don't know, they made me come. I thought I had another doctor's appointment. So usually they'll say sadness because that's what they connect. So of course it's intense sadness, usually because someone that we love has died. No typical timeline for grief and bereavement because it really depends on a lot of the underlying factors. Sometimes it's the type of death. Working with families that have had a loved one die by suicide, working with a family that has had their loved one die by a homicide. Those right there, those are the kids that I try and reach. That's my focus, is the type of death, because it's very traumatic for them. And you will hear me say this over and over and over again, that in order to have the children grieve in a natural process for them, we have to first process that trauma, because they are stuck in that trauma. So I see you all nodding your heads, because we know what that's like when our kiddos are stuck in that trauma. We have to help them process, and that is our job. Okay, so really briefly, I want us to see this video. At the center, we use the model of the 4 tasks of bereavement. And then he's going to briefly go over the tasks, and then I'm going to share with you how we use that with the model.
Why don't we talk a little bit about the genesis of the editions? Because this 4th edition was published in 2009. Mm-hmm. The first edition was published in 1982. So
that's why.
What has changed and what has evolved in your thinking to distinguish this from the first edition?
Oh my goodness. Well, I think this reflects a lot of the research that's out there. I try to keep current with everybody's research. Some research is better than others, but try to keep the book current there. Basically, the book is centered around the tasks of mourning.
What are the tasks of mourning?
That when somebody loses a loved one to death, there are certain things that need to be accomplished, and so that's sort of the nexus of the book, the model. And the texts are, you first of all have to believe that it happened, and then deal with the affective pieces, and then adjust to a world without the person, and then find a way to move on without necessarily disconnecting from the dead person, some way to memorialize the person and move on. So.
And how would you distinguish your work, say, for example, from Kubler-Ross?
Well, Dr. Kubler-Ross was talking about stages of dying, and then along the way somebody, used those stages for bereavement. She never intended that, in my judgment, having done research with her in the early days. But I think any model that talks about stages really gets locked into sequential movement. Yeah, and so by using the task model, which comes from developmental psychology, there's certain tasks. These tasks have a fluidity. They can be worked, reworked. Some are very easy to accomplish. Others, cause people to have some problems. But it's a good model because if somebody's stuck in their grief, then it gives you an overlay, a model to figure out how they're stuck and why they're stuck and how to help them get moved on.
So I share this with you all because even when I started working in bereavement, we all know the 5 stages of grief, and that's what we used to use. But I like how he describes that the model that we use is not sequential. So in other words, this is how I always say, grief is like that old jalopy we had when we were in college or we just got out of high school. And it's turning and it's like, please, please start. Okay, pumping the gas, pumping the gas. Please, please start. And it starts. And then you're like, okay, it starts. Get me to where I need to go. That to me is grief, that old jalopy. Because all we can do is hope, wish, and pray that we get through that day, through that hour sometimes. So that's why it's not sequential. Now, this is the tasks of mourning. Number 1, accepting the reality of the death. So accepting that as a child and at their cognitive level, they are no longer going to be able to touch their person. That person is not going to be able to talk back. So the physicality of that person is gone. Task 2, working through the pain. All right, now that I am trying to accept that my person has died, what am I feeling? And a lot of times when kids are saying, I don't know, guess what? They don't know. Do y'all know this book, A Terrible Thing Happened? If you don't have it, please, it's such an amazing investment. I love Sherman's thoughts are all scribbles. Imagine a child at their cognitive level trying to understand why mom died by suicide, or why would somebody want to kill my mother or my father. So the I don't knows are those scribbles. What we as clinicians do is help identify those emotions. We get them out. The number 1 thing that I'd like to do with this task 2 and affect modulation, identifying those emotions, is teaching that child how to, number 1, identify. Number 2, how do I describe it in order to share it with my caregiver? Because that's the goal, is to identify this is what I'm feeling, describe what that is, and share it with my caregiver. And you'll hear me say that over and over again. Task 3, living in an environment where my person is no longer there. How do I cope with going back to school? And I got STAR testing. How do I go to school and see other mothers with their children? How do I go and play baseball again knowing my dad is not watching me in the stands? For young adults, how do I go back to work? How do I handle finances? I never had to do finances before. Coping with now this person not in your environment. And then, of course, task 4 is finding that connection with your person while embarking on a new life, but I guess it's moving forward. How do I celebrate this person? Or can I even celebrate this person? And we'll talk a little bit about that later. Childhood traumatic grief. Okay, a lot of these symptoms, and I'm not going to go through all of these because there are a lot of PTSD symptoms. What stands out is overwhelmed by that trauma response. What cues them? to have that flashback. A lot of our kiddos have those film strips in their head. Now, PTSD is two things, and we all know that as clinicians. I think that the hardest one for our children, or most difficult or challenging, is not knowing. And sometimes they can create their own narrative of what happened. What did Dad look like when he died? Was it scary for him? Was there blood? Those are the things that our children are thinking about. And that secondary PTSD, imagining what it is, sometimes it's worse in our head, and we all know that, than what it really was. Some depressive symptoms, of course, anxiety. Again, those unresolved symptoms is facilitating that child to be stuck in that trauma. And what being stuck, they're not able to go through that flow of grieving naturally. Another thing that you will hear me say is natural. A wise woman once shared with me, she took out normal out of her vocabulary. So what is normal bereavement for one person isn't for another. What is natural for me? So you will hear me say natural, where maybe you're used to hearing normal. The symptoms, again, unwilling to accept the death. And that's that first task. So they're stuck in that first task. And maybe there's a reason why they're not able to accept that death because of the traumatic way or type of death. Positive memory avoidance due to triggers of the death. So if there's something that's cueing them to the type of death, then it's hard for them to remember some of those positive memories they have with their person. Guilty feelings towards forming new relationships. So if I am playing with my uncle too much and I love my uncle, does that mean that I didn't love my dad? Those are the things that our kiddos are thinking about. Again, and then trying to not engage in things that they used to do before. Again, maybe they were swimmers and mom is no longer cheering him on in the crowd. So little things like that. Again, the trauma symptoms are blocking the natural mourning process. I will say that over and over again. The trauma symptoms block the natural grieving process. And that is our job as healers and clinicians, is to help them process that trauma so they can get to grieving naturally. So we have some assessment tools that we use. If you're familiar, how many here are familiar with TF-CBT? Quite a few of you. So of course the TSCC and then the TSCYC is the assessments that we do for TF-CBT. So if a child has come in and there has been an outcry of physical or sexual abuse or maybe some neglect, then maybe that's the tool that I'm going to use first to process that grief. And once we have gotten to that, we will go on to the next, which is the gift. That's the gift, is the grief-informed foundations of treatment. That gift is a powerful tool in bereavement because what that does is it helps us focus on 3 categories. I will go over the gift in a little bit. So those of you that are familiar with the TF-CBT, we use practice components. I'm going to go over the PRAC right now. I have something actually that kind of helps. This is what we use with our model, and this is kind of what I did when I explain it to families, because sometimes our language is not the natural language of our clients. So practice is what we use. The P stands for psychoeducation and parenting. This is what we're going to help the parents. This is like sometimes when we're doing that parent consult, that's the exhale. Maybe their child has been exhibiting some behaviors that they're really concerned about. So this is when we normalize some of those behaviors with a lot of psychoeducation. So it's helping the caregiver facilitate healing at home by having a better understanding of why those behaviors are present. Relaxation. We need to learn to relax and self-regulate in order to speak about the uncomfortable. If a child is coming to see you and they have some type of traumatic loss, we have to make them feel comfortable before they even feel safe sharing those uncomfortable thoughts. And that's a process. So what we do is we will help them, teach them some relaxation techniques, maybe some meditation. We're actually going to show you some of those in a little bit. So relaxation, helping them regulate while they're talking about the uncomfortable that maybe may cue them to the film strip. Does that make sense? Okay, affect modulation. Most of our clients don't know what that is. It's emotions. It's identifying those emotions. Learning how to identify those feelings in order to share and show our caregiver. And we have some really fun things that we do that we're going to share with you also. Cognitive coping, there it is, that connecting between the thoughts, feelings, and behaviors. That's my CBT coming out. Now, what this does for our client is when we're in that task 3 of living in that environment, going back to school. What if something triggers me? I'm in school. Mom's not there. Dad's not there. Caregiver's not there. How do I self-regulate? Interesting thing, I had a little guy who, we have a big dance studio, and we have little pillows, little flat pillows that they can sit on. We have a stack of them. So while he was giving me his narrative, he was throwing the pillows. But he was putting them all in order. So these are the plaid pillows, these are the purple pillows, but he was separating them. First instinct is, well, let's sit down and let's talk. No. What was he doing? Self-regulating. If somebody is sitting down and their leg is shaking, I'm a knee shaker, you know, when you do that. I'm self-regulating. Don't stop me. I need that to get through that conversation.